Welcome back, everyone. From transitioning from a great conversation on the intelligence community to the current issue of the global aspects of the COVID pandemic, I am thrilled to introduce you to our guests for this session. First guest for this session is Mr. Steve Olive. Steve is the Senior Deputy Assistant Administrator of the U.S. Agency for International Development. As a Senior Foreign Service Officer in the Latin American and Caribbean Bureau since 2018. He was the Acting Director of the Foreign Service Center in the Office of Human Capital and Talent Management from 2017 to 18, which is great because we are definitely looking for career insights from all of our sessions, and that well positions him for that. He, in the agency's Kenya and East Africa program, he was the Deputy Mission Director for Somalia from 2014 to 17. He concurrently served as the Acting Deputy Chief of Mission for the U.S. Mission to Somalia from 2016 to 17. Prior to that, Dr. Olive served as the Deputy Mission Director for USAID Haiti. He was the Interagency Coordinator for the Food and Economic Security Pillar and the Infrastructure, Energy, and Engineering Pillar under the post-earthquake strategy from 2011 to 14. So we can see, in addition to being in charge of the current COVID response in Latin America specifically, that Dr. Olive has experience in managing emergencies from the international development perspective. Before he joined the agency, he worked in Hawaii, Guam, American Samoa, and the Philippines as the Environment and National Resource Policy Management and Policy Specialist. His degrees are PhDs in Political Science from the University of Hawaii, a Master's in Public Administration from the University of Tennessee, and a Bachelor's from the Miami University in Ohio in Public Administration. Also, I'm invited to join the call today, and this was a reason you should all follow FIU News. It's always available on news.fiu.edu and on FIU's homepage. Professor Abu Shonchoy is an assistant professor in the Department of Economics. And if you go to FIU News, there's an article up on the homepage about him collaborating with the World Bank in order to use data to track the spread of COVID globally. And so that was very relevant. We invited him and are incredibly pleased to bring him into the FIU and DC fold. He's an assistant professor at FIU in the Department of Economics. His interests are in issues of global development with a focus on evidence-based policy research, financial inclusion, skills training, infrastructure, and education. He has ongoing field experiments in South Asia, looking at migration and labor force participation, and of course, with all that's going on right now, including the response to the pandemic, or the tracking of the pandemic. His degrees are PhD in economics from the University of New South Wales in Australia, Master's in economic policy from Australian National University in Australia, and a Bachelor of Social Science and Economics from the University of Dhaka in Bangladesh. So I'm very happy to have both of you here today. Thank you for joining, and thanks, Carlos, for sharing that link about Professor Shonchoy's work. I'm going to start with Dr. Olive. And so, Dr. Olive, you're in charge of USAID's COVID-19 response in Latin America. Can you tell us what USAID's COVID-19 response in Latin America is?
Yeah, thank you very much, Eric. And I appreciate the invitation and a chance to talk with all of you. First, let me start with a bigger picture. Sure. That when there are pandemics or other disasters around the world, that the United States takes an all of America approach. That while my agency, the United States Agency for International Development, often takes the lead on providing support to other countries, we do want to recognize the enormous impact that non-government organizations have, other private sector businesses from the U.S. and foundations in the U.S. that respond to these crises in a big way as well. And even other departments and agencies within the federal government will also help in some way. I'll just speak to what we're doing at the United States Agency for International Development. And as Eric pointed out, I'm with our Latin American and Caribbean Bureau, so I'm most familiar with our work providing assistance to the countries in this region. Obviously, for this pandemic, we are providing assistance around the world, our agency is, and I can speak a little bit to that as well. But we received a supplemental funding from the United States Congress to deliver overseas assistance. And for the Latin American and Caribbean Bureau so far, that has totaled almost $70 million going to several of our countries in our region. And if you have questions, I can talk with you through what some of those countries that we have been helping. It's about 15 to 20 at the moment. And our assistance is based on need and requests from the host governments. Thankfully, U.S. Agency for International Development has been working in these countries for many decades in our region, and many of them on building up their health and strengthening their health systems. So in places, for example, like Peru, where I was stationed between 2006 and 2011, we really helped to build the capacity of their health system so that when things like this pandemic started, or the Zika virus outbreak a couple of years ago, or malaria or other diseases, that they are much more capable and ready to respond, so that the assistance provided from the US government does not have to be as great as it might have been in the past. And so right now, we're focusing our assistance on strengthening the case management system in some of the countries that we're helping to prevent the prevention of infections, not only of the coronavirus, but other infections that may result by having more people in the hospitals, for example, and the enormous need to control infections in that environment. We're also helping with their laboratory capabilities so that they can increase their testing. We're working on how do they receive patients into the health system. You may be familiar with that in the US, as you know, now you call in if you have symptoms, et cetera, to your healthcare provider rather than just showing up, because showing up puts other people at risks. And we're helping other countries to put that system in place. And then how are they going to surveil and respond to new cases in the community to be able to isolate them and make sure that once there is an infectious breakout, that can be isolated and dealt with. So those are kind of the things that we're initially looking at in helping other countries in our hemisphere, and that those funds are moving out, as well as our technical assistance. We have 13 missions in Latin American and Caribbean where we have actual Americans as well as locally employed people in those countries that are also providing very important technical assistance. So even without additional finance assistance, we have many of them embedded within the health ministries to help guide them through this pandemic. And then we're definitely looking forward, not forward looking to what's going to be needed down the road. What are the second order effects of this pandemic? You see it in our own country with the massive impact that it's had on our economy, and it's going to have on the economies of Latin America and the Caribbean and around the world. And in fact, I know our professor can probably talk about some of the growth projections of what I've seen for Latin America is there's going to be negative growth that the World Bank and the International Monetary Fund are predicting as much as 5% negative growth in the region. And so we're also thinking of how are we going to position ourselves to help these countries' economies to be able to recover from this pandemic. And so a lot more to say, but those are my introductory remarks, and I'm really looking forward to our question and answer period. Over.
I'm looking forward to that too. That's always the best part of it, and I spend most of the time on that. You mentioned that the agency is doing work around the world, and because you're focused on Latin America, and our audience here, while not exclusively interested in Latin America, is very interested in the region, and some of them are actually joining us from homes and family homes in Latin America during this intercession. I think an interesting way to explore that would be if what's going on in Latin America, it can be contrasted with other regions in any way. Is there any dynamic or factors that are unique to Latin America compared to what the agency is having to deal with in other regions? Perhaps.
Yeah, that's a really great question. And it varies very much country to country, region to region. Obviously, the virus got to Latin America and the Caribbean later than it did in countries such as Asia. Secondly, we don't even have a full idea of its impacts and spread in the region because every country's testing abilities vary greatly. Right now, based on the testing that is done and the reports from countries, Brazil has by far the most cases of COVID-19 in our region, next to the United States, followed by Peru and Ecuador. We've seen countries like El Salvador, who took very drastic steps early on to control the virus, where they locked down the country very quickly in a very dramatic way, which has certainly stopped the spread of the disease more so than in other countries. But it also limited businesses and freedoms, et cetera. But they did take very close action. And then we have countries that we're not sure are doing a lot of testing and we don't have a lot of data on, such as Nicaragua, Venezuela, where don't really have a good picture of what may be happening in those countries. So it really varies country to country. I would say Brazil, Peru, and Ecuador, we're pretty confident in the information that we're getting from those countries, and therefore they have been some of the earlier countries that we've been providing assistance to. And again, I'm happy to go in more depth with other countries, but that's a overview. And compared to Asia, it's less assistance, but the Africa countries, and Africa being such a big continent, is getting a little more of our assistance. But certainly, it's a very robust response here in Latin America and the Caribbean so far.
Thank you. I do want to delve into a little bit of the organizational nuts and bolts of how things play out in the agency. I want to, before doing that though, I think some of the comments in your first two answers do speak to Professor Shonchoy's work. And I know you just mentioned some countries have more data than others, and also some of the economic factors. I know that kind of tracking the data is what Professor Shonchoy is up to. So we'll move into kind of later talking about the role of the World Bank and things like that. But for now, Dr. Shonchoy, can you talk about what your research is, what you're looking at, and any findings that are relevant to what we're talking about so far?
Sure. Thanks, Eric, for having me here, and great to be with Dr. Steve Olive in the same forum. I am a big fan of USAID's work. I have been following their activities in different parts of the world, so it's great to be in conversation with all of you.
Thank you.
I appreciate that. So let me give you a big picture that why the research we are doing is very important. So what is in United States or other rich countries may not be possible in developing countries because of resource constraint. So say, for example, the testing ability and data. When I'm originally from Bangladesh, it's a South Asian country. And what we have been doing so far in Bangladesh, which is the maximum testing capacity that Bangladesh has in a day, is only 5,000 cases in a day. Compared to USA, this is we are talking about in millions. If you do a comparison, then these countries do not have at all the required resources to do massive testing. And why massive testing is very important, because I need to know what are my contamination spots. Because if I can detect what are my contamination spots, I can immediately do drastic actions. It's like lockdown, stopping economic activities, doing contract tracing, massive surveillance, and so that we can contain the spread of the disease. Now, developing countries, one, they don't have the testing capacity, and second one, they don't have reliable data. Then we need to find some innovative ways to find what would be the contamination spots. So this is kind of the main broad picture why this research is extremely important. So I have been researching on South Asia for a long time, and I'm a labor economist myself. So I know that this disease will be spreading through the vector of international migrants coming back home. So let me give you a bit of background. So countries like South Asia, they have a big chunk of foreigners working in developing countries and sending remittance back home. So one of the biggest contributor in their economy is remittance. So when there is this economic recession and the COVID-19 outbreak, many of these workers are now laid off all over the world. So for example, in Bangladesh, in the case of Bangladesh, we have many people working in the Europe, Italy, France, Germany, and also people working in China and in Korea and also Singapore. So because factories are closing down, economic activities are closing down, these guys are coming back home. And when they're coming back home, not only they're bringing their activities with them, they're also bringing the disease with them. So when they come back home and they will go back to their origin districts, it is highly likely that they will spread. So what I thought that might be useful is to, since we don't have data, what if we can find the migration stock variables from the available data, right? So every country has some form of national household survey. Like, so it is either funded by USAID, because USAID has been extremely efficient in terms of funding household surveys all over the world. So if I look at the national household surveys, most of these household surveys has a module about whether you have a family member who is a migrant person, and if it is a migrant person, which country this person went to. So what I did for Bangladesh, which is they have a household income and expenditure survey on 40,000 households around the whole country. And from there, we detected what are the household composition in different parts of the country. And obviously, there are parts of the country where more family members are having a migrant family, like type of migrant families, compared to other areas where they don't have any migrant families. So based on some algorithm and some sophisticated machine learning, we can detect that these are the areas where we will have more outbreak of the disease than the other areas, just because of the migration vector. So just to give you a simple analogy of this, the local stock of migrant household is a very good predictor of COVID-19 spread. So what I first did is I first collected this and ran an algorithm, and we find an index. So the index could vary from, say, in the bandwidth of 100, that means extremely migrant populant area, versus 0, there is hardly any migrant population in that area. And then we have the COVID-19 outbreak data, right? Each day countries are releasing data that, okay, we found somebody in the north, somebody in the west, looks like the central Bangladesh is getting more spread. So we ran a very simple correlation, and it looks like that our prediction is pretty accurate in terms of the migration hotspot. So I just give you a number. So the migration stock variable itself can explain 60% of the variation in the COVID-19 outbreak in Bangladesh, 60% of the variation. So that's a massive indicator that one country can use, lacking the testing capacity, lacking reliable data, that using the national household surveys to find the potential COVID-19 hotspots. And then once we detect these hotspots, what they can do is they can now allocate the resource properly. Because as I mentioned at the beginning, they have resource constraints. So they don't have hospital beds, they don't have, say, ambulances or testing capacities. They don't even have proper records of contact tracing. So if I can determine that these are the areas where you need to focus, then this country, instead of going for all-out option, can focus in those particular areas and do a stringent policy making. So just to give you an example, say for in case of Bangladesh and India, they have, say, X number of testing kits available to them. So one option could be for them to distribute the testing kits equally to everyone. But what I'm saying, or my group of researchers is saying, that would be a bad strategy, because your disease is going to spread everywhere similarly. There will be some areas where the disease will spread now, and there are some areas there where the disease will spread later. So if you have limited resources, then you need to prioritize those areas first. So if you have 1,000 testing kits, I don't want it to be distributed equally. You need to focus on those areas first, do stringent lockdown now, because this is where it will spread faster. Then later on as Steve was saying, there will be a secondary wave that might be coming. At that time, you can reallocate the resources in that area. So by resources, I mean, if there is a lockdown, then there will be many people who will go hungry, right? Because when I'm locking down the economic activities, these countries have enormous amount of people working in the informal sector. By informal sector, that means they don't have a paycheck, they don't pay taxes, and they don't have registered business. So in USA, it is easier to do, right? I mean, I can issue a check against the tax file numbers, but in developing countries, they don't pay tax. So in case of Bangladesh, only 2% of the entire population pay taxes. And these are not the people you want to target. You want to target those people who are like ghosts. They're informal sector and they don't pay taxes. And once we are locking down the industry, locking down the economy, these people will go hungry. Now this is a battle between lives and livelihoods. So by resource allocation and prioritizing resource allocation, what I mean is, number one, focus in these areas in terms of testing, focus these areas in terms of ramping up your medical capacity, and also focus on these areas for government subsidies or handouts or payments. So that's why this research is very important. And so once I wrote the initial draft, then my colleagues in the World Bank, they say, why don't we do it for South Asia? We joined forces with the World Bank, and then we created the same heat maps for South Asia. And now we are getting more requests. So it's amazing how internet and social media is very effective. So there was a blog post written about it, and now the government is Ghana. The Ghanaian government recently reached out to us and said, can we help them to have their heat map? So let me make a hard stop here and wait to hear from you. What questions? Thank you.
Thank you for that, Professor Shonchoy. And it's great to see that type of work going on right here at our FIU, for sure. And I've seen Dr. Olive have a lot of response to that in his body language. So I'm going to, before asking my own next question, just ask him to chime in on anything that you just said, or any other thoughts on the importance of data and how the agency is using data.
I really just like the way Dr. Shonchoy described, how you go about this in a country that just has very limited capacity and doesn't have all the testing and things at its disposal, because that's always the problems that we face when we're providing assistance to other countries. So I really enjoyed his explanation of how you decide how do you allocate very scarce resources and prioritize. And as he mentioned, that's exactly what we try to do with USAID. We're not going to provide assistance that solves the whole problem for any particular country. Our goal is to work side by side in partnership with those countries to do exactly what Dr. Shonchoy was suggesting, of just making very strategic decisions of how to control the disease, and then being ready to plan for what happens in the second wave or the second order effects from it.
Thank you. Looking at kind of the organizational factor, a certain number of months ago, we did not know we would be in the situation now. How is USAID set up so that when a disaster or crisis emerges, it's known who's going to take the lead on that? Is it just automatically you're a high-level official in the Latin America Bureau, so that falls to you? Is it based on subject matter expertise of whether it's a health crisis or economic crisis, et cetera? What does that look like? And is the response primarily new projects focused on the response, or is it also a kind of triaging or trying to save the impacts of the existing projects that were going on in the region, before we knew this would be our state today?
Thank you. That's a great question. And it goes back to some of my opening comments. Number one, the U.S. Agency for International Development is a very decentralized agency where most of our work is done in missions that are based overseas in the countries where we're providing the support. So it's a big advantage to already have people who are in country, who already have the relationships with the disaster response experts, the health experts, et cetera, in the country, and right up to the leaders of the country. And so that when an emergency like this breaks out, we're already out there and with people in place to be able to respond. Secondly, I think it's important in any organization, and this is certainly how USAID approached it, for these kinds of events that occur, it is important to set up a task force that's focused on this. And so USAID immediately did. First, we set up a crisis response team in early January just to monitor how it was happening across the world. And then that led to us establishing a COVID-19 task force. And so that task force pulls people in from all of our bureaus, both our regional bureaus like the one I'm in, but also some of the things we call our pillar bureaus, like our Bureau for Resilience and Food Security, or our Bureau for Humanitarian Assistance, et cetera. It pulls in people from all of those bureaus together into a task force to be able to take in what are the needs out there, to be able to make decisions, or at least offer decisions up to our agency, offer recommendations up to our agency leadership for decision. And as well, and probably the most important thing when it comes to disasters and pandemics like this, is really do a very good job on communication. How you communicate within your organization, how you communicate publicly to other organizations, how you communicate to the citizens in other countries is so very important during these types of events. And so our task force does a tremendous job of every day taking in a great deal of information and then making sure that key decisions are communicated out, that we're clear on how we're supporting the different countries, what we can and cannot do. It is really important from an organizational perspective. And so my role then is we have a couple of our health experts here in Washington that we assign to the task force. So there are eyes and ears of how the task force is operating, and they're the ones that feed specific information of what's happening in Latin America and the Caribbean. And so it really does help us to have that link into the task force.
Thank you. Sticking to the organizational theme, I'm going to ask Dr. Shonchoy about the World Bank, and then there's already great questions coming in from the group, so I'm going to turn it to them immediately over than that. So Professor Shonchoy, so we've heard about USAID, that is an international development agency, federal government agency, and kind of their work. You both in your current work collaborate with the World Bank and have had a previous role at the World Bank where you were physically based in DC for a time. And the World Bank is headquartered here and has a large presence here in DC. So we like our students to know about them too. Can you talk a little bit about what that organization's mission and role and function is, and why it's important to collaborate with them on a project like this?
Sure. So I have both the pleasure of working with World Bank and in World Bank. So I was working as a consultant before, and also currently doing a lot of collaboration work with the research team, working in various different disciplines. So let me rephrase this kind of answer in two different ways. One is World Bank has a very important role to play in terms of evidence-based policymaking and influencing evidence-based policymaking, not only for the global development agenda, but also for the country offices. So not only there is a Washington DC operation, they also have country operations, and they work very closely with these offices together. And in terms of activities, there are thematic activities that World Bank is doing, social safety net, but also they're collecting tremendous amount of data, and the local team in Washington, DC, and some of my colleagues who are great scholars, and they are all from great universities. They have the first-hand experience of collecting this data, analyzing the data, and writing policy reports. I think no other institute in the USA produces that number of international reports as World Bank is doing. And these reports are all very, very sophisticated analysis. It is data driven, and it gives direct policy directives for the government. So as you know, as I mentioned, many developing countries do not have the required expertise, and they don't have the data set, and they don't have the resources. So World Bank plays a very important role, not only all these mission specific activities, but also helping government with the right policy making. So just to give you one example, one of the most successful program in education is Conditional Cash Transfer Program. It was initiated in Mexico. It's called Oportunidades or Progresa, but has been rolled over all over the developing countries. So where families get money to send kids to schools, and World Bank is one of the first agencies that did a rigorous evaluation of Conditional Cash Transfer Program and how it is very effective to reduce the child labor, because many kids are involved in child labor, and also enhancing the academic capabilities of this generation. So this is one of the greatest of World Bank in terms of helping government that understand that this is where your money should be going, and which is like education sector, conditional cash transfer programs. And with the same note, at this moment, at the pandemic time, World Bank is working very closely. As I have been in conversation with many of my colleagues, they are talking about how to do this transfer of money to the needy people, like those people who will go hungry, those people who lost their jobs. They are working very closely with government. At least I know in India and Pakistan and Bangladesh, the social safety net program is working very closely with the government to derive policies to help transfer this money to the right person. So there is a question of, targeting failure, that you might wonder that I am distributing the money, but the money is going to the wrong hand. So they are working very closely with the government to find ways to do the right target. So, and I should applaud World Bank for this kind of activities, and I am also in conversation with them to help that. So, yeah, so, yeah.
I'm going to start turning it over to the students. Some great questions are already here. So, Andres, would you like to ask your question to our guests over video?
Yeah, sure. Thank you for the opportunity, first of all. This is a specific topic that's very personal to me because I did my senior thesis. I actually graduated today, and I did my senior thesis on the Zika outbreak in the Americas and policy assessments as a partnership between FIU and the Department of State. And one of the most frustrating topics was the case of Venezuela, of course, since the US AAD, it's based on collaboration. What is the best approach to do when a government does not want to collaborate with this partnership? And it's not an issue that it's only affecting this particular country, but because of the humanitarian and migratory crisis, it's already a regional threat. And it's a country that it's already facing many preventable diseases among the population, like malaria, measles, diphtheria. So of course, not having data for these diseases in the past, in the case of the Zika virus, they hidden the data for 2 years, saying that they didn't have any cases in the country. And then after the third year, I think they sporadically increased the amount of them. So this is an example that can affect this COVID-19 situation. So my question is like, how is the best way to approach that, not only in an underdeveloped country, but in an underdeveloped country that does not want to collaborate? Thank you.
Thank you, Andres. Appreciate that question, and you're hired. You're welcome to come work with us, because that was a really excellent review of your thesis and the issues that we're dealing with. So congratulations on your graduation. It is very tough in Venezuela now. Right now, our focus is on the migrant populations, as Dr. Shonchoy was saying, how important it is in watching the migrant populations, Colombia in particular, but also Brazil, Ecuador, Peru are countries impacted by the migrants. And as you eloquently said, there was a time when we were very close to declaring malaria, South America as being malaria free or heading in that direction. And then when the economic crises hit Venezuela and the health system started to collapse, and you had these migrations, all of a sudden we saw a spike, not only in malaria, but other infectious and transmittable diseases. And now COVID-19 is really a major concern for us. So our first and foremost is to provide those assistance to those border countries to be able to respond to when the migrants are coming in or the impacts there. Secondly, we continue to try to work with the Maduro regime through the United Nations on providing assistance, but it has to be available and fair to all Venezuelans. You know, it's assistance that can't be controlled and determined, well, you can help these people, but you can't help these people. It needs to be a policy and a way of getting assistance to all folks. And we're trying to make those inroads. We have not been successful on that just yet, but we're doing our best to work inside Venezuela, because you've laid out very effectively what is the issue. And, you know, and as you said, it's not just impacting Venezuelans, it's impacting the whole continent. And that's why we do hope that we'll be able to do more work inside Venezuela, that they will take seriously the testing that needs to be done and address this crisis that's really spreading in the region. So thank you very much for your question.
Thank you for answering, and I really appreciate all the work that you're doing.
Thank you.
Clarissa, you want to ask yours?
Yes, thank you for giving me the chance to ask my question. So my name's Clarissa. I'm a third-year student here at FIU, and my area of interest is U.S. foreign policy in less developed countries. So I was wondering about the refugee camps in Kutupalong, Bangladesh. The UN recently reported that the camps are overcrowded and they're living in unsafe quarantine conditions amid the pandemic. So what is being done by USAID and other parties to tackle this issue, to protect these displaced people from a possible really quick spread?
Dr. Shonchoy, do you want to start first, or do you want me to start on that one?
I actually don't know much of the ground realities of the Rohingya refugees in the Cox's Bazar areas. I mean, like you, I am also reading the newspapers, articles, and being extremely concerned about what's going to happen to the very vulnerable population of Myanmar origin Rohingyas. So I think Dr. Steve might have better answer than I do. Thanks.
Great. Well, thank you very much, Clarissa. I really appreciate your question. I do have to say, since I cover Latin America and the Caribbean, I don't have a lot of information on Bangladesh. I do know that in these first couple of months, we have provided $4.4 million for Bangladesh, and their focus is on some of these migrant camps and et cetera. And that assistance is going for case management, surveillance activities, infection prevention, control, risk communication, and then very important in these camps are the water, sanitation, and hygiene programs. But I apologize, I don't have any more specifics other than your point is very well taken, that places where people are congregating, as we know with this virus, it spreads people to people. It's places where people are concentrated in close quarters is how it spreads. And we have the same concerns you do, but that's the most I can say on Bangladesh at this time.
Yeah, Bangladesh has taken a really big amount of refugees, so it would be really upsetting for them to have to deal with, a really big outbreak. It's doing good more than they even can, more than their economy can even handle, but thank you.
You bet.
Jose and Jennifer both have questions about whether the quarantine policies in Latin America have been the right ones. They're from slightly different angles. I'm actually going to ask them to back ask their questions, and we'll take that as perhaps a reflection on both, since they're somewhat related. Jose?
Sure. Thank you very much, Eric. Good afternoon. I am Jose Ignacio Grados, and I'm an international student from Peru, actually. And I am majoring in political science, and my focus is primarily on government relations and crisis management. So from my point of view, when I see what the current government in Peru is doing, I am, of course, very proud of many of the policies taken. However, my question would go more on specifically government strategy and how USAID sees it when the lockdown or, well, forced quarantine has been either the correct assessment, seen as resources have reached a critical mass right now, and the shift from eliminating the virus, well, for what the government called eliminating the virus, and the virus now having spread, the government has changed this strategy to allocating resources and investing in the timetables for the usage of these resources. But my question would be, has it been too little too late, maybe? And another follow-up question that would include Professor Shonchoy would be a more economic-driven question, seen as specifically in Peru and Colombia, many countries have taken economic strategy and fiscal policy in play while the crisis is ongoing. And is this the correct approach for resource management? Should we begin changing fiscal policy in the middle of a crisis? I would like to hear about either your opinions and positions regarding this. So thank you.
And Jennifer, you're on the ground in Colombia. Would you like to add on to that question from your current country-specific perspective?
It's just I would like to know right now from what Jose was saying, it's pretty similar, and like I put it there, I hear often people just die from the virus. So adding to that, I would like to know what are some of the plans that USAID has to help alleviate the socioeconomic effect immediately and for the long term. And I apologize for background noise, my little brother's in class.
Well, thank you very much, Jose and Jennifer. Jose, what part of Peru are you from?
Well, I'm from Lima, but I do have a couple of family members in Arequipa and Cajamarca.
Oh, very good. Beautiful cities indeed. And Jennifer, are you in Bogota or another part of Colombia?
No, I'm in Manizales, which is in the central Andean part of the region.
So anyway, I don't mean to not answer your question, but to be honest with you, I have the same question. It's a little bit too early to know if the lockdown measures were the right ones and were effective. I know there will be a lot of analysis of that in the months to come. We're still learning so much about this virus and how it spreads, et cetera, that everyone is working on incomplete information, all of these country leaders. I was pleased to see this week, I saw some opinion polls from your countries, and both of your presidents, the opinion polls, their popularity, et cetera, is rising in terms of how their population is evaluating their response to this crisis. And so that is good to see that when people and citizens are holding their leadership accountable and are seeing that their leadership is taking the measures that they want to see, that's exactly how we'd like to see democracies operate. So it is good to see that those presidents are being responsive to their citizens. And so I really, again, I don't want to, we just don't have the data to understand were these lockdown measures appropriate or not at this time, or where they were taken, et cetera. And we're just going to have to wait and see how the crisis plays out. Over to Dr. Shonchoy.
Yep. Thank you. Thank you. That's a great answer. I couldn't even answer like that. Jose, I really appreciate your question. So there are two parts, if I understood correctly. One is whether these stringent lockdowns and lockdown measures, are they really effective? And because there are two parts of it. One is what we call flattening the curve, like whether lockdown can flatten the curve. And another part of it is because we are stopping the economic activity artificially, whether that causing a lot of problem in terms of livelihoods, whether people don't have enough food to eat and they're going hungry, and we don't want people to die without food than die with the COVID-19. So this is a very important question. So there are two strategies that we are observing. So one is, as Dr. Steve mentioned, that we are still learning every day. Every day new data are coming, and we are trying to kind of get a sense out of whether flattening the curve is really happening and if lockdown is working. But when we say lockdown is a very misused word. I mean, what is lockdown in Florida is very different in New York, right? So I'm just giving you my country example, right? I mean, Florida lockdown, you can go to Jacksonville and you can see people are there, right? So in the beach. So lockdown in Florida versus lockdown in New York is very different. At the same time, so lockdown in Lima and lockdown in Bogota is very different. And same is true in Italy, in India, in Bangladesh, and all over the world. So then if we want to run an assessment, if we run regressions about like having just, okay, what is the impact of lockdown? We have to be extremely careful how stringent the lockdown was. Is it like absolute no movement, or it was like essential business was operating, whether there was like free flowing agent, only this travel ban happened and limited economic operations were working. So we have to be very careful. But so far, the data shows that if you have a stringent lockdown, like a really strict lockdown, it helps to flatten the curve. That is what we have seen in some countries where they have done very strict lockdown. Now the question is, as a policymaker, like financial side of it, what are the strategies government can do? Are they acting too fast or too slow? This is also a question that we to take a bit slowly, because at this moment, the way I understand, because I'm a developing economist, I'm not at all a macroeconomist, so please pardon my ignorance on macro, but I think what is the most important priority at this moment is saving lives. So if you have to borrow from external sources, if you have to borrow from bilateral agencies and multilateral agencies to save lives, ramp up your medical capacity, give government handouts, I think government should do that. Once the pandemic is over, then they can start talking about what are the factors that they need to take into account to kind of facilitate this. Either they need to borrow, because countries will get 3 hits. As Dr. Steve was mentioning, there will be a negative growth of 5%. And it is very different based on country to country, because those countries that depends on oil, say for example, they will get a different hit, versus those countries that are dependent on remittance income or foreign direct investment, right? So foreign direct investment is not coming in near future. If you are dependent on remittance income, like Philippines, it's a very big country that depends on remittance income. They will get a hit in terms of remittance money is not coming back home, right? There will be other shocks in terms of the trade. Say, for example, Bangladesh, which is known for ready-made garments, right? So if you go to Gap or H&M, you'll see made in Bangladesh, because this is produced in Bangladesh and shipped in USA. So we are not purchasing clothes as we used to, right? So then they will get a shock in terms of their supply chain, their external orders. So these factories will not be able to sell products. So there will be a lot of workers laid off. So there will be a lot of consequences, but I think we can get over with it, as other economists are saying, because when there are economic crises, there are ways, there are toolkits that we have that we can deploy to fix it. But saving lives, this is a one-way journey, right? I mean, if somebody's life is lost, there is no way we can get it returned. If the economy is getting some shock, there are ways to fix it. So I would say, like for any government, that the priority should be saving lives, and saving lives now. And what is the most important thing to do is kind of ramp up your testing capacity, ramp up your medical capacity, help those people who are going hungry, and we can fix it later, the economic issues. I'll make a stop here.
And Jennifer, to Dr. Shonchoy's last point, the food assistance, that is something we are looking at. we carefully consider that, because as he has said, many ways it's cash transfers are the best system for that, because when food is available in a country, but it just needs to be redistributed to those who are food insecure, that cash-based system is so much better because it keeps the economy going, buys local products, etc. And it's always the last resort for U.S. Agency for International Development to bring food into a country. But we currently are in our region looking at a couple of countries that we feel may get into a very severe food insecurity situation and how we might be able to help there. In terms of the longer term economic impacts, again, we'll need to wait and see how the pandemic plays out and what parts of the economy are harmed, and then what are the best solutions. Because as I mentioned at the outset, our goal we're not a charitable organization of giving things away. We work in partnership with the host country to help identify where are the biggest needs, what would be most appropriate for a country like the United States to help with, and not just from the U.S. Agency for International Development, but from our private sector, our non-government organization sector, et cetera. We really look at these more holistically before we decide on what intervention to do.
Thank you so much.
Thank you very much for your answers.
The way I'm reading the questions, both Melissa and Rose have questions that I perceive to be centered on actions that other agencies, both U.S. and federal agencies abroad, might be taking, and they might have impacts on development work or USAID's work. So I'm going to take those as a pair of questions as well. Melissa, did you want to share yours over video?
Yes, hi. I'm Melissa, student of science, arts, and education, and I believe in fixing the problem from the root. So I was thinking, why not make testing, health screening most, and instead of going in after the fact. The virus, I did some research on my own, and the virus it already mutated once, so it's gonna be prone to mutate again. Okay, so this is gonna happen. 1 year, it took 3 years since the flu, since the bird flu, to mutate. So if we see this pattern happening, why not make it the norm to start screening passengers at the airport, or have them show a health a document from a doctor, just to prevent more, the closing of our economy and all these unfortunate, deaths. So, yeah.
I'm going to have Rose add on to that and make sure that both panelists have a chance to address both questions at once in our final few minutes here.
Hi, thank you. My question is in regards to an article I read, an article from April 21st that was published in the Washington Post about the U.S. Deporting migrants who are infected with COVID-19 back to Latin American and Caribbean countries. And I was just wondering how that move maybe has affected the work that USAID is doing in the region, or any of the NGOs, any of the partners in that region, if that move has affected their work.
Well, thank you very much, Maritza and Rose. And again, Maritza, you can come work for us as well. That's a great approach in some of the things that you were saying to get to the grassroots part of the problem. And I'll just mention what I meant. It's so important for us as a U.S. government to work with the host government and help talk through what should be the priorities, what's available within the country to purchase and to use, what is the capacity of their own health systems, and then make those decisions that you're asking about of how to handle airports and other parts of the country and other approaches. All I can say is, each country is unique, and I just feel it's really important that we as the United States Agency for International Development work with them side by side, provide some guidance, ideas, best practices from other countries is one of the things we do very well, so that they can learn from what other countries did and work with them to develop their own solutions. And Rose, our piece of this, USAID's piece of this, of bringing when folks that are repatriated back into their country is just a small piece of it. But we do, for example, in Central America, help support the reception centers where those repatriations occur. And in those reception areas, we absolutely then factor in testing, proper equipment, et cetera, and procedures for dealing with them to make sure that people are aware if they have the virus, and then if they need to be quarantined or if they can go back to their communities in making those decisions. Again, we're just a piece of an overall U.S. government effort on that, but in those repatriation centers that we're helping to provide some assistance to, that we do take that into consideration. Over.
Thank you. Do you have time? I think we had you both till 3:30. Is there time for one more question? Because I see that Alex has one question for both of you.
Okay with me.
All right, sounds good. Alex?
Yes, to Mr. Olive, Dr. Abu Shonchoy, thank you for taking your time and enlightening us about the COVID-19 response within your respective fields in Central America and the Caribbean. My question to you, Mr. Olive, you were talking about in reference to how the USAID is a decentralized agency. So my question to you is how you were able to pivot personnel and from other initiatives to deal with the COVID-19 response within the partners in Latin America and the Caribbean. And for Dr. Shonchoy, I know that the World Bank has an operational response for COVID-19 to shore up the disease surveillance within countries. And I know that they are starting within a few countries within Latin America. On the long term, what will be the objective for the World Bank to actually get those countries more into a position to, from the short term, which is helping countries in getting the equipment that they do need and they need to have, to more of a long term and basically pivot that response to a more long term response of helping economically the country and their initiatives. Thank you for your answers. Appreciate it.
Thank you, Alex. Again, thankfully, because U.S. Agency for National Development is decentralized, it does make it a much easier for us, because if we were all based in Washington, and especially with this type of pandemic where you can't travel, or a lot of people can't travel to affected countries easily, it's really advantageous to have people in country. And what we've seen where we've had to pivot, and each country is doing the same thing. For example, in some of our countries, we had fairly robust disease surveillance activities where we were surveilling for other diseases like malaria, pneumonia, tuberculosis, etc. And so what we've done is those staff then now are more focused on COVID-19, both in the host country health system and USAID's support as well. So yes, people have had to pivot, but thankfully the fact that they were in country thankfully, the fact that these host countries were already pivoting themselves, it wasn't as hard for us as it could have been, given the fact that we were decentralized.
The question that Alex, you mentioned to me is, I'm not actually appropriate person to answer that. I don't know exactly what the World Bank strategies are for helping these countries, but what I heard and what I have been hearing from my colleagues, that they are thinking about three strategies. One is like the immediate response, and one is midterm, and one is long term. And the immediate response is exactly the items that the points that I made is about helping for food assistance or cash assistance, and then making sure that the government have enough resources. If not, then giving them a new line of credit to purchase some essentials. That could be medical equipment, so that could be even other activities. And then at this moment, I think the country office are working with other economists to derive some midterm policies. So we will soon be hearing from World Bank about that. And also I am in part of the conversation with many country economists and country policymakers. So World Bank is also conducting a series of conversations, like this kind of Zoom meetings with the policy advocates. So where there are World Bank people, there are people like me who are independent researchers, and also there are policymakers, to have some informed conversations about what Dr. Steve mentioned, like what are the best practices, which country has done what, and that showed some evidence. So helping governments to do some right strategies and approaches given the pandemic.
Thank you.
Yeah.
So with that question answered, I'm going to give my greatest gratitude to both of our guests. I think that their dedication to answering your questions as thoroughly as the situation and data out there allows, and their, I think, care and attention to your interests and your backgrounds and your career futures has been unparalleled as well. So we're going to let them go, and I'm going to invite also all of you to stay on for a few more minutes for both Carlos to give some closing remarks of our 3-day fly-in series, and I can address any questions about the conclusion to the program through the virtual badge. But let us all thank Dr. Olive and Dr. Shonchoy for taking this time out of their day to engage with us. I thought it was great.
Thank you,
Eric.
Yeah,
thank you very much. Congratulations to all the graduates, and congratulations on this seminar. It looks like it's very fruitful, and one I would have certainly liked to have taken when I was an undergrad as well. So continue with these great best practices. Thank you, Eric.
Yeah, Sam, I'll echo exactly what Dr. Steve said. Thank you very much. And I think this is a great initiative, and please keep on doing it. Yeah. Thank you.
Appreciate that from both of you.
Okay.
Carlos, would you like to take the first stab at some closing?
3:38, and we're in the thanking mood. Eric Feldman, we have to give our wide thanks. You can do it with your little applause feature, or you can do it live, but we wouldn't have had 3 amazing days to see all, just about 98% of the group. There's all the applause. Look at that, Eric. For all 3 days, it's been great. And I know that we take pride of our face-to-face fly-ins, but this has been an amazing first, because it's great to see you all engaged. I believe she's still on the line. Sabrina Roselle, our outgoing, or now former student body president. Thank you to student government for your support of FIU in Washington, D.C., as well as our incoming president. It's great that you all had a chance to meet Alexandra yesterday. I do want to ask that maybe in your chat feature, just give us one word, one line, something unexpected that you learned over these last 3 days that you didn't know about, either on the corporate side. I'm curious what that is, if you can just drop that in there, because I think that'll be helpful for us to understand. As I started out the experience on Wednesday, welcome to the FIU and DC family. You've actually just, once again, experienced a great representation of what the FIU and DC family is. In this case, you have a very accomplished professor engaged with a very important, critical global organization like the World Bank. You have a federal partner like Mr. Olive that is engaged with the university, not only in experiences like this, but because Latin America and the Caribbean is very important to FIU. USAID is very critical. You combine those two together, you add the talent that I'm staring at in our monitor, in my monitor, because whether it be current students, recent grads, alumni, or friends and partners, it's this collision that we live for. It is what FIU in Washington, D.C. is all about, and you're now part of it. So you got a taste of it this week from a global issues perspective, and I think you had a great taste just reviewing of a few days, corporate offices, federal agencies, think tanks, the 3Ds, as I'll now refer to them, on the defense side, and more defense and intelligence development and diplomacy. I think one that is still pending for us, and unfortunately, I apologize, there was some scheduling complications, but I think for a future session, and maybe even if we reconvene next week, we can try again. I think the congressional side is important. Many of the folks that you did meet with interact with Congress or started in Congress as staffers, but I think it's always important that you engage with those staffers, and we have many amazing staffers, some FIU alumni. We have about 45 or so alumni working in Congress. About 25 of those are here in Washington on the Hill, and in many great important roles. So that's a slice that we know that, and remind yourselves, yes, they love our talent, as you all have proven in these last few days, but they also love FIU, and there's a bit of a credibility factor here. If anyone would like to stroll down historical lane, Google Charles Perry, our founding president, and how our university was envisioned and begun some 50 plus years ago. And from day one, from his first, charting documents, there was a vision that this university was going to be globally engaged, was going to be globally focused, connected to a lot of these key players. He was laughed out of the room in many ways because a university that doesn't exist, that's about to open up on an airport tower, at the table on global issues. Yeah, right, buddy. But he had a vision, and in many ways it was even further than where people saw Miami going. But a lot of these players also appreciate Miami for what it is. So a bit of advice there, and as you're looking for opportunities in these spheres, sell FIU and the fact that you are FIU, sell Miami, the fact that it is such a unique outlier of a city within the United States that is very much engaged and touches so many different cultures and is represented. So also remember where I use the term competitive advantage, a reminder. Let's be frank, the economy is not what it was 3 months ago. So you're to be lauded for being focused on, completing your degree and looking for opportunities like this. But our future has just been handed to us in a virus, and both the challenges we're going to be facing, but also the opportunities. So what are the opportunities here today that I think you'll get tired of us repeating? But once again, you have a network in Washington, D.C., and it's been touching today, even on the occasion of the commencement. You have the American representative to the Inter-American Development Bank, Republican Trump appointee. You have the chief of staff to a congresswoman from New York, a major Democratic player. You have a leader of all the Latin America programs of the Heritage Foundations, a major think tank. These are all proud FIU alums. You have a team like us, Eric, myself, I see Travis there. I think Anthony Rionda has joined us in Miami. If you don't know Anthony, when you do get a chance to be back on campus, you have a team. We get so excited to hear you all ask these questions because it just proves you're spot on. And you heard it from him. I meant to apply a little pressure. I believe the job offer was to undress. You have witnesses here. So that was great to hear. So use us, but use us very effectively. And what we ask of you is just to be on alert. Be monitoring these opportunities, be monitoring, the internship roles that Eric promotes, in keeping your dialogue open with us. I think Eric would underscore, be honest and genuine with us. What is your passion? Put that on the table. Whether it be homeless policy, whether it be, nuclear issues, whether it be Latin America, that only helps us better calibrate, what connections might be possible. So that's important. Apply for these opportunities, show up. You've heard us, and I think the last potential, the most 11th hour opportunity for us now to plead. If you are interested in the Hamilton Scholars, let us know now, apply now. If you happen to know of other stellar friends that you think would be, you've just experienced, I think, what we will live for an entire semester in the fall. Deep discussions like this, engage with key players. So those are some of my words. And I did, as I started on Wednesday, Ruth Hamilton, who hopefully at some point you all will have a chance to meet, her quote in this email to me this week is, "Do express to our students our thanks for their commitment and hard work they're putting forth to discover and enhance their profession. Our country and our world needs them." So I think I would reiterate her words. And with that, Mr. Feldman, back to you.
Thanks, Carlos. And I am, I think it's been such a fulfilling 3 days. It's the first time we've done a virtual fly-in, and I couldn't be happier with it. It's been a really fun 3 days at work for Carlos and I. And I have to thank all of you for making our jobs enjoyable, because the things that could go wrong in a experience like this could be people no longer showing up. It could be people not having questions. It could be people having kind of boring questions, and none of that was true. You all stuck in here and had the most thoughtful questions, and we really appreciate it. Even my after hours emails have gotten a lot of good responses. I didn't know if people would be interested in the extra work of earning this badge, and I've been getting a lot of communication on that, and we're seeing that in the chat right now, and I think that speaks a lot to this group. We definitely are going to reconvene next week. I think, since this started at 10 o'clock on a Wednesday, I'm going to go ahead and set 10 o'clock next Wednesday as a chance for us to reconvene. And if multiple sessions are necessary, if some people can't make that, we'll make that happen, and get some good breakout rooms going. I think both with the people with similar interests and people with totally opposite interests would be a fun way to do that. I could take questions about the badge. The ones that I kind of know that I've seen so far is if there's a deadline, and we'll make up one, to be quite honest. But I'm going to say the end of next week, because what happens is, I have to go review everything you've submitted against those detailed rubrics that are there in Canvas, and approve everything and send things back for revisions if necessary, and then let the team that Bridget Cram, who you met yesterday, runs, know who's earned the badge, and certainly having everything in a week from right now would facilitate that process. So do that. I've also gotten, I think, the question about whether the career LinkedIn posts has to address all 3 days or all specific sessions. And the thing I really want to say about the LinkedIn post, because that's the assignment I'm most excited about. Writing reflective things that get submitted to me is a useful exercise. It helps you think about what you learn. It helps us know what you learned. But this assignment to do some sort of public post giving advice you learned excites me, because I think what's most powerful is sharing what you learn with other people. So on that, please focus on unique and actionable advice. So a lot of the advice that we've gotten from our guests are things that are true, but they're also things that, were not horribly surprising, some of them, about networking and being adaptable. So what I'll be looking for when you turn those in is how to make those like operationable to your peers. So I think, peers are already used to knowing how to network. Was there any advice that we learned about a specific way to reach out to someone on LinkedIn, about a specific way to research who you should be networking with based on their title or organization? How can you really extend that up beyond, what your peers are expecting to hear about career advice? And and it does not have to address every single day, every single session, but certainly if the advice came from a specific person and you haven't added them on LinkedIn yet, go ahead and add people that you were inspired by and tag them so that you expand your LinkedIn network as well. And there's also some great conversation here about how to list this on your resume. That was prompted by Travis, who put into the chat there to do that. Earning the badge is definitely the way to display this on your resume. Passive experiences such as conferences attended and seminars attended are things that can add value to a resume and that should go on resumes. Though a higher order thing is when you've earned a designation, a certification that you presented at something more active. So I encourage you to put on your resume, but to do it through using the badge. The badge, and then there's a lot of different ways it could go on a resume depending on what else is there. So that's where I'll refer you if you haven't worked one-on-one with Travis yet. And he's Dozier at FIU.edu, putting that in the chat. Consult with him one-on-one on the specific way to add that on your resume and things of that nature. So all 5 assignments are due Friday, more or less. I think they're all, and there's flexibility there, but I think that's very doable. They're not that expensive, and if you need more time than that, I know many of you are working. Many of you may be working extra to support family members during this time. So to the extent you could do things in a week, let's do that. And to the extent that's not possible, it's not a problem.
And it's been good. Eric, just to chime in, some of your comments here, this is a great example. Tiffany, you mentioned the Y7 and the Y20 summit, and how YPFP plays into that. But we're here to also receive a little bit of direction from you all. If there's an interest in, for instance, I learned a lot more about the Y20 summit and the Y7 summit. So I'd be curious how FIU can really have a strong presence there. But we happen to know folks that it won't be taking place in person, but that are working on the G7. How can we think through those connections? So I'd also ask, and it doesn't have to be in this chat feature, but help us help you. Are there things that we should be programming? Are there opportunities that we could be thinking of? The Zoom reality is new for us too. So as Eric already said, it's been great to see that this got pulled off successfully. So any other questions for Eric or I? I think, we do have a few minutes in case anyone wanted to. No? Okay.
I put the link for next Friday's session with Joe Stoltz from the Library of Mount Vernon in the chat there. Go ahead and copy and paste that in RSVP right now so you don't forget if you're interested in that. And I'm happy to announce, though I still have to log off of this and make a flyer for it. The second of our impact series for the summer, of which there'll be multiple sessions a month, is with Tanisha Agramonte. Tanisha is the director of the Office of Civil Rights at the U.S. Department of Commerce, and she's participated in in-person fly-ins before, and she has wants to share with you her insider tips for career success, specifically the unwritten rules for career success. And she's going to be joining us later in the month in the morning of the 27th. So you'll be seeing that in the newsletter as well. So stay engaged with us as well. So Krista, those are 2 of the upcoming opportunities through our Impact series, which will be going on all summer long. And yes, Tiffany, thank you for asking Lazaro's question. Certainly, you can apply for future fly-ins. especially since you participated in a digital one. Even some individuals have done multiple in-person fly-ins because they're on very different topics and they're not repeated things. But especially I think I'd say not only can you, I mean, we want people from this fly-in who have not been on an in-person fly-in to do that. We want to see you here in person when we can.
Another pitch I'll add, because I know we constantly hear from our members of Congress, but we also do our best to help place students in a lot of those offices. And that's in line with, yes, the Hamilton Scholars Program, but even beyond that, that's a great opportunity for students. They are paid, so we know that that's important. I do see that Anthony Rionda, Professor Rionda, is on the line. Not sure how many of you all are current honors college students, but Anthony also, Professor Rionda, do you want to give a quick commercial on the course you offer that I think was year-round or is now going to be semesterly?
Please call me Anthony. You too, Carlos. Appreciate that. I'm going to start calling you something, Dr. Becerra. Congratulations. I know a few of you, and I teach a few courses for the Honors College. We're opening the Hamilton Scholars application is obviously open to everybody, but the Honors College will be teaching our first course in DC, integrating some of the things you're doing now or we'll do in person in DC. I'm sorry that my camera's off. But I teach a course called The Political Cycle, offering it in the summer. I don't know if some of you might be. I emailed it to students that I have in my class this semester. So that's in summer A and summer B. But starting in the fall, it's just one semester at a time. So the whole course is in one semester. So this is awesome. Congratulations to all of you for doing it, for staying on, for taking the advantage of this. I tuned in for a little bit of Vince Houghton and Brian Fonseca. I tuned in yesterday for some of the conversations with Abdel Pereira, who's a good friend who's in Milan. And I don't know if he talked about where he was stationed, but he's Pakistan, Argentina, Milan, gets to see the world and experience a lot of cool things. But take advantage of it, and make sure you take advantage of Travis and Eric and Carlos and myself and anybody else who can help you. And today's commencement day, so I know a lot of you graduated or are graduating. So think big. Don't just limit yourself by what your cousin or your tia or abuela or somebody told you. Break the rules. Follow the law, but break the rules.
All right. Well, you know where to find us. You all have the rest of the day off. Carlos, Anthony, you have the rest of the day off. Go home.
Thank you, boss.
Yes, sir.
All right.
We'll be in touch.
We'll see you. Have a great weekend.
Thank you all.